just watch the recording if you want to, stay caught up. So anyway, I gave us this little quote today from Nelson Mandela, because we're going to be doing trivia, and I was like, yes, trivia, knowledge, it all comes together. So yeah, education is the most powerful weapon which you can use to change the world. So let that be your like vibe. Okay, so first we're just going to go through some updates. So from my team leads, if you guys have anything that you would like to like update us on, I have time for you guys to do that if you would like to.
I can quickly go just a few things. I'm Alexis, by the way, if you're new. I'm the community building education lead. If you are interested in having a leadership position next semester, feel free to reach out to any of us to learn more about the different options. And we also, if you don't already know, we have like teams. So if you're interested in being on a team but don't want to be like the lead, that's totally okay also. So if you want to just get more involved and want a little bit more leadership without like completely going full in, then a team would be a really good option for you, I think. So if you are interested in anything like that, you could reach out to Julie or me or any of the other leads to get more information on which one you're interested in. So yeah, and again, I always say just make sure to like tell your friends about the club and get more people involved, because the best way for us to have the biggest impact is by building our membership. So just remember to think about people you think would be interested in our club and our organization to get more involved.
Awesome, thank you. Anything from fundraising?
Not really much to report, but I'm Katie, I'm the fundraising chair, and I have to leave in a few minutes actually, but again, just like Alexis said, if you want to we're going to do like election stuff soon, and so if you have any questions, reach out to any of us. But for fundraising, we're already past our goal, which is super awesome, but we're going to do, we're planning on doing like a virtual 5K Strides for Solidarity in the first week of April, so we're going to plan that and get that going soon, and so we'll work on this month and stuff. But other than that, not much. And if you are personal fundraising, keep going, and that's all I have to say.
Awesome, thank you. So yeah, and they already kind of touched on, I was going to mention we are starting our process of getting the executive positions filled for next year. So we will have some of those open. We'll introduce like the application process. If you're interested, definitely, like they said, reach out to us. And then one thing I want to share with you guys is Partners in Health sends out a newsletter every week. And if you guys are interested in signing up for it to like get more information, I will send you this link now. It just takes you to their website, but if you click on the subscribe button up here, you just put in your email, and it will send you their newsletter once a week. So let me send that to you guys now, because like, yeah, there's always so much information and I cannot cover it all. So there's a link to that. And then the next one is, so Partners in Health Engage has this crash course. And essentially, if you want to learn more about like Engage and what we do and like why we do things the way that we do, and like the history of Partners in Health more, I really recommend completing this crash course. If you want to be like considered for an exec position next year, then like you will have to complete this, just because like if we're operating as like the, if we're part of the team, it's good to like have as much information as you can. So I'll send you that link as well. It's a bit lengthy. It'll take you like 1 to 2 hours. You can break it up. You do have that option. So if you go here and you like say you click to, I don't really know how, anyway, so you'll click through, and then if you want to save it, you just click through to the end and then press save, and then you can come back to it. And if you have any questions about it, definitely reach out to me or any of the other leads. Okay, so that is that. Okay, and then this is the updates on the advocacy campaign. So for anyone who is newer to the meetings, advocacy is one of the 3 focuses that we have. And this really deals a lot with like talking to people who are working in legislation. So whether that be a senator or a House of Representatives member or the legislative aides or stuff like that, we like vocalize Partners in Health's like goals in terms of like getting funding for certain bills and making sure people have the access to healthcare, which is like the whole idea, right? So I thought I just like would update you guys on like the main goals that we have, because we're going to be scheduling some meetings coming up. I have to work on that tomorrow because I haven't heard back from an office that I am expecting to. Anyway, so the campaign background is the last emergency spending bill signed into law on December 28th, 2020 contained $4 billion for global vaccine access, but did not include the billions we need for global funding that we identified to Congress. The bill allocated $22 billion for testing, tracing, and COVID mitigation programs in the US, but we need billions to build a public health workforce to respond to COVID and improve the US health system. So what we're going to be asking for is we're asking that our members of Congress advocate with leadership for at least $20 billion in global funding and supporting the Health Force, Resilience Force, and Jobs to Fight COVID-19 Act by signing on as a co-sponsor. And I know this is like a lot of information to kind of take in at once, but we'll walk you through all of that like when the time comes. And then another thing is, so I recently got updated on our by our coach. She has been with Partners in Health Engage much longer than any of us, so she's like our mentor. And we do know that we asked for 75 billion, or that sounds right, 75 billion last semester for the contact tracing and that like area of things, and we got like 62 billion of the 75, so that's like successful thus far. And then in terms of the, so like you can see here, we wanted 20 billion for global funding, but we only got 4, so we're really going to be pushing that as well. And like I said, if you guys have any questions about any of it, please just like reach out to me and I'd be happy to fill you in on some more. In the newsletter that I just sent out, there's a link to the advocacy campaign like summary, like the complete summary. So if this is like, you know, a very short viewing of it, if you want to learn more, the link to that is in the newsletter. And like I said, you can just ask me and I'll also send you the link. So, okay, I know that was a lot. Does anyone have any questions? Okay. So then this is like one example of some advocacy work that we do. So this, I will send this link in the chat. And this is like a very simple filling out a pre-written email. You just like add your name onto it. And oh my gosh, why can I not get this chat? There we go. So basically, it's a pre-written email that Partners in Health Engage like has for us, and you just fill out your information if you would like to, and that is dealing with the, how do I go back? There we go. So that is dealing with the Health Force, Resilience Force, and Jobs to Fight COVID Act. So if you click on that link, you should be able to see like the field, and I'll show you right here. I haven't done it yet, so I will fill it out with you guys. So yeah, you'll just put in your first name, your last name, email, phone number, if you want to. Again, this is completely optional. This is just one like opportunity to like do advocacy work. And so basically you can see like what the letter says, and it's asking for the health workforce to be strengthened, and then literally like that's all it is. So like it's like so quick. So yeah, if you guys have any questions about that, and then if you do decide that you'd like to send an email and you complete it, just send me a message so I can keep a count, because we have a goal of sending 50 emails per semester, and we are around 12 right now. So if you guys like fill this out and then let me know, I can like track that in our progress. Okay, any questions about that? Maybe more about the information included or anything? Okay, cool. Like I said, let me know if you decide to fill it out. Okay, now to the main event. So we're gonna be doing a trivia little Kahoot thingy that we all made together. A lot of people sent in questions, and Elise and myself also added in some questions. So we're gonna do that now. Originally, we were going to do like a review of the information prior to doing it, but it didn't really make a lot of sense logistically. So we'll just go over any questions or like information during and after the Kahoot. So I will, let's see. I honestly don't know if I'm going to do this correctly. My team knows I'm really just well known for having technical difficulties. So I think I want to do the host one, right? Does anyone know? This looks right.
Yeah, the host one.
Okay, thank you. Yeah. Okay. And then player versus player, I think, should be good. Okay. Oh my gosh, you guys, I forgot about the music that goes with it. Okay, cool. So I won't be playing, obviously, because I know all the answers. Haha. Awesome. Cool. Smiley face, love it.
What comes out? Yeah, we can't say photons, right? A photon is
Okay.
a single stream of light.
See, there should be about 4 more. There we go. Okay, but yeah, so I think there's different categories that we had. So we did OSU, we did Partners in Health, and then we did like global health. So, and yes, the prize is while you guys are doing that. Oh, sorry. Okay, I'll put the game pin in the chat, but I want to show you guys. Oh wait, okay, we only need one more. Nope. But yeah, so the prize for winning is you'll get a Partners in Health sticker that were designed by Aya. I don't know if that sent. Okay, yeah, so I'm gonna close out of this really quickly because I have the links to show you guys. But yeah, so she designed all these, and these are the options if you win. It's very exciting. My favorite is this one. I think it's like, I don't know, I'm like obsessed. I love it. So yeah, they're super cute, and yeah. Okay, back to it. Okay, we did it. We have 10 people. Okay, I'm starting the game, you guys. So serious business. Okay. I don't know, like, do you guys want me to read the questions out loud, or I'll just sit here and if you have questions. Oh, that was a majority. Well done. Okay, on to the next one. Oh my gosh, this is so cute. Aw, little scoreboard. Okay, nice job, Ellie. In the lead by 4 points. Okay. First national championship. Honestly, I'm glad I'm not playing because I don't think I would get this.
I made the question. I still don't remember.
This is for like the hardcore fans. Oh my gosh, how did so many of you get that? What? That's amazing. That's wild. Wow. Oh, Ellie's still a lead. You guys. Cool. There's many questions left. Don't worry. Okay. Who is the Buckeyes' main rival? Okay, honestly, this better be 100% or else I'm ending the meeting. Yeah. Great job, guys. Successful. Okay, so I think I put all of the OSU ones in together. So we know what's coming up next. Oh, cool. Yeah. Okay. So last year, so there's like engaged teams. Like we're not the only one. There are 71 other teams this year, but last year, how many teams were there and how many of them screened Bending the Arc? And Bending the Arc is the documentary about Partners in Health. We just screened it a few weeks ago, and we'll do it again. Oh, nice job. So yeah, so it's a tricky thing because like there was only 56 teams last year, and now there's 72. So like we've gained like 16 new teams, which is really awesome. And they got 90. I think it's like 90% or 96% of them like screened the Bending the Arc. So anyway, next question. Okay. What is the name of OSU's mascot? I feel like this one. Well done. Well done. I tried to think of like creative names, but did not trick anyone. Okay, next. Oh, this is a good one. Nice. Yeah, honestly, like, wouldn't you wish it was dogs though? Like, if they were just little dogs, I would be so happy. All right, on to the next one. Wow, Ellie is still in first place. You guys, this is, I mean, you know, I want you to win, but like also someone should like sneak in there. Okay, next question. Who is John Glenn? This is a lovely photograph. The bow tie really just, it really does it. Mm. Oh, wow. Wait, oh my God, wait, you guys. Okay, I remember when I tested this out, there was a question that was off, and it was this one, and I forgot to fix it. So, you all got it right mostly, except for the dog show one, which I low-key wish was true. My bad. Yeah, it is blue, Cisse. I know. Okay, so, I don't know how to like not count this one. Just know that I'm very technical difficulties, right? We talked about it. Okay, moving on. But yeah, he was an astronaut. Yeah. Okay, I'm so sorry. I think the rest are fine though. So what year was Partners in Health founded? Oh, wow, I'm gonna like cringe about that for so long. Yeah, founded in 1987 by, does anyone know the founders? Besides the team leads, that's cheating. But does anyone know the founders of Partners in Health? No. Okay, so Dr. Paul Farmer was like one of them, and then Dr. Jim Kim, Ophelia Dahl, and Todd McCormick, and then Tim White was like the main fund provider. So those were the original founders, but like it gained like there were more people as it went on. And you would know, you know, if you watched Bending the Arc, then you'll like learn more about them. So nice. Okay, Ellie's still in first place. So, you know, I love it. Love to see it. Okay, which of these countries does Partners in Health not collaborate with? Wow. Okay, nice. Yeah. So what collaborating with in this sense means like we have like partners in those countries. So like in Rwanda, Lesotho, and Peru, like we have partners in health operations that work with the people in those communities and like help strengthen their health workforces. So yeah, and you can learn about that on the website if you go here and then you go to our work and then countries. It's really cool to see like all the, I think there's a map, maybe. So yeah, you can see here all the countries and like you can learn more about the different like projects that we have going on there. So yeah, there's a lot of great information on the website. Next question. How do I, oh yeah, okay, cool. Wow, guys, Ellie's killing it. Okay, next question. Which Partners in Health president was a founder of, oh my God, I also definitely messed up this question. But not really. I technically didn't, but I definitely did. So it's supposed to say which Partners in Health founder was a president of the World Bank. Yeah, so it was Dr. Jim Kim. So yeah, he wasn't a founder of the World Bank. He was the president of the World Bank. That's my bad again, but I feel like most of you could see through my technical difficulties. Yeah. So, but yeah, so also the United States is like in charge of staffing that position, and when it comes to the World Bank, like we get to decide. And he was nominated by President Obama back, I think it was after the Obama like term, but yeah, and that's also in the documentary. Again, technical difficulties. I'm really good at it. Okay. Where in Haiti did Dr. Paul Farmer begin his work? Back in 1987. Well done. Okay, yeah. So this is Conj, and you'll learn more about that if you read Mountains Beyond Mountains, or if you watch the documentary Bending the Arc. They talk a lot about that. Actually, I think Mountains Beyond Mountains covers it a little more in depth than the documentary.
Also, if you guys haven't read Mountains Beyond Mountains or watched Bending the Arc, Bending the Arc is on Netflix. Like it's a documentary on partisan health and stuff, and about the founders and everything. And Mountains Beyond Mountains, a lot of us read in like one of our public health classes. But like I personally really don't like reading, and I just saw that the book was like awesome, so I think it's a good read. And even if you're not a big reader like me, but you could also always just watch the documentary. I think it's like an hour or maybe like an hour and a half or so. But it's super cool if you want to learn more about the organization.
Yes, thank you for throwing that in there. There's also a free PDF of Mountains Beyond Mountains online if you don't want to buy the book. But I think some people it's like nice to like have the book. But yeah, so thank you for throwing that out there, Alexis. Okay, next question. Hopefully I don't have any more like technical difficulties and like typos and stuff, because I don't know. It's embarrassing. Okay, what are the three teams of partners in FGH? This one shouldn't be too hard. Nice. Yeah, so it's not outreach, it's community. I mean, it honestly, it's very similar if you think about it, but yeah, it's just a much longer name, community building education. Long one. Okay, overall fundraising goal for the Maternal Center of Excellence in Sierra Leone. And for those of you who may be like newer to the meetings, the Maternal Center of Excellence in Sierra Leone is a maternal health clinic that we are helping to build in Sierra Leone. They're one of our partners, and it's set to break ground in April this year. And yeah, so Partners in Health Engage is hoping to contribute $100,000. It's a $25 million total cost, and we need $20 million to break ground. And I think we're getting close to 19 million. So we are like making progress towards it. It might even be closer now.
Right now.
What'd you say?
Okay, right now we're at 97,000.
Oh, yeah. Okay, so that's the dashboard.
Yeah, that's for the engage. All the engage chapters, we're at 97,000 out of our 100,000 goal for the year. So we still have plenty of time too.
Yeah, awesome. So yeah, we're killing it is the main point. Cool. Okay. Next question. Oh, Alexis is moving up. I see you. I see you. Okay. What is the percent of reduced stillbirth rates at Koidu Government Hospital in Sierra Leone? So this means like how much were we able to bring it down? So not the original, but how much were we able to reduce them? Yes, 50%. Still one person got it. I bet it was the person who wrote the question. But yeah, so that's pretty significant. I mean, that's like 1 in every 2 like stillbirths is no longer. So like we saved like 50%, which is pretty good. It could definitely need to be lower, but still. Okay. And this is another reason why we're like focusing on the maternal health center. Sierra Leone had the highest rate of maternal mortality in the world. And so like this is dealing with the child, but whenever there's a complication with like the child, the mother is also like at risk. So it like all goes together. So yeah, okay. Next question. Okay. Okay. In 2018, what was the life expectancy in Sierra Leone? Yeah, 54.3 years. And then in the US, it was like the US, it was 78.8. Or I think, yeah. So like in comparison, that's like like almost 30 years, like 20, 24 years. So it's a big, huge gap. So yeah, I think it's better now, but like it's still not good. So again, oh shoot, we got a new leader. Oh man, the competition is getting heavy. Okay, how many mothers per 100,000 births passed away in 2015 in Sierra Leone? Yeah, so 1,360 mothers passed away for 100,000 births, and in the United States, the same year, only 14 per 100,000 in the U.S. passed away. And that's like one of, again, like it's the epicenter of maternal health issues. So that's why like that's our focus in terms of like the project in Sierra Leone. Because like that's literally like 100 times higher. So it's crazy. It has gone down. I will say it is gone down. It used to be 1 in 17, and now it's 1 in 20. I know the numbers are slightly different, but there has been improvements. So there's that as well. Okay. Oh, a short-lived spot. That's okay. Oh, that's funny. Oh, this is fun. I miss doing this in high school. This is fun. Okay, 4 out of 10 hospital visits in Sierra Leone are due to malaria. Yes. And then I think traffic-related injuries are like the country's highest cause of death. But yeah, malaria is like the most reasons for the hospital visits. Okay, next question. What is the main export of Sierra Leone? Diamonds, that's correct. And yeah, so in terms of like the exports, it's not really even fair to call it an export because Sierra Leone like makes zero money out of it. All the like diamonds have been like stolen essentially. Not really. Like they're not actually stolen, but it's like the people who control the diamond mining and the retailers that sell them, 0% of the profit goes back to the Sierra Leonean people and like government and like taxation and everything. So like they're making like no profit off of their natural resources, which is not okay. So next question. Let's see, Aya has a streak. That's fun. 3 correct answers in a row. Well done. Okay. Oh, well, which language besides English is the most spoken in Toronto? Say it's still. I expect this to be correct from you. Yes, Creole is the correct answer. Okay, next one. Also, yeah, say if you want to like demonstrate some Creole for us, that'd be super cool. If not, that's fine. But yeah, okay, Emma in the lead, a new leader. Okay, next question. What was Sierra Leone for during the transatlantic slave trade? That's what that stands for. I just didn't have enough room to write it all. Kahoot yelled at me. Yeah, so what was Sierra Leone known for during the transatlantic slave trade? Oh wow, a lot of you guys got that one right. That I didn't know that before someone sent the question in, so I'm proud that you guys knew that. Is it something like you guys learned about in like a class or was like guessing or like? Just like yeah, I don't know how you guys learned that, but I love it. I love that you guys got that. Okay, next. Okay. Which is the capital of Sierra Leone? Again. Freetown, that's correct. I think Montenegro might be a country. Yeah, okay. Next question. Oh, we're getting close to the end, you guys. Okay, next question. How large is the gap in life expectancies? Okay, so this is like from the highest life expectancy in the world to the lowest life expectancy in the world. Like, how large is that gap? Per country, like by country. Yeah.
Oh no!
Did you
Oh,
put
did
that
you
on
hear?
what?
I'm sorry, I forgot to check my mic. my five streak just broke.
Oh, you lost the streak. But yeah, 36 years, and then 47 is the lowest life expectancy by a country. I don't remember which one, but I know that is the lowest, which is like, that's like crazy. Like 47 years is the shortest amount of time. So another issue that needs to be addressed in the world. Okay, last question, you guys. So I expect 100%. Oh my gosh. Okay, wait. Yeah. So when was the slave trade stopped in Sierra Leone? So not the transatlantic slave trade, but just like slave trading in general. When was that? Yeah, so it was in 1928, which like I think is insane. Like that's less than 100 years ago. So this was a lot of like international, no, not international, within the continent of Africa. There was like slave trades going on then. So like it obviously wasn't outside like being exported. But yeah, like individuals were still like suffering through that until 1928, which is like crazy. So let's see the final results. Oh, the podium, that's just cute. Okay, in third place, we have Ellie, 14 out of 23. Very nice. Julia, 16 out of 23. Oh wait, is it a tie? Oh, but I guess you answered faster. And Emma is the winner. Round of applause. Well done. Oh, we had runners up. Oh, how cute. Awesome. Okay, cool. So that was fun. Okay, Emma, let me know what sticker you want. Okay, so I'm gonna leave the site. No more music. Awesome. Okay, what do you guys think of the Kahoot? Thoughts? I see a thumb up. Good. Would you want to do something like that again?
Yeah, I think it's engaging, and like, we learn a little bit more about what we're actually doing.
I think it's really cool because like a lot of these things, like it's kind of like eye-opening. You know, you don't really think that it's like you're like, whoa, like how is that even possible? You know what I'm saying? So it's really cool to like see the facts, and then you can really learn more about, like Cece said, like learn more about the cause that we're working towards.
Yeah. Cool. Let's see. Jack said you loved it. Awesome. Cool. So yeah, I had a lot of fun, except for the technical difficulties. Next time I will triple check and make sure that I don't switch words around or have wrong answers. But yeah, okay, so from there, I will hand it over to Aya.
All right, so we're just going to do a quick little discussion to end the meeting. But basically, we just want to know what was one thing you learned, and you can unmute, and this can be something that you thought was interesting or surprising or that you just didn't know before and want to talk about it. So anyone can go ahead and say anything.
I think that reaching the $100,000 goal, and it's really pretty amazing within the time frame that we had.
Yeah, it's really exciting that we're only, was it 3,000 away now? Something like that?
Yeah.
Yeah, super cool.
I didn't know most of that stuff about Sierra Leone. That was mostly just me guessing. So lucky for me, but it's also really interesting.
Yeah, I thought a lot of the history was super cool, and it's always really important to kind of understand the social context for health. So I thought that was like very informative.
Yeah, I agree. The diamonds thing always makes me kind of angry, like, because they're so valued for no reason really, and the whole country just doesn't even benefit from it. So
Can anyone guess what the well, I feel like some of you might know this, but the largest like exporter of diamonds out of Sierra Leone, what company? It's Tiffany's. So, oh wait, got it, something in the chat. Let's see. Oh, okay, cool. So anyway, it is Tiffany's, but yeah, so Julia said she can't talk out loud, but she agrees with you guys. Have you guys seen the video talking about the diamond thing because it's so upsetting? Julia, do you mean the one by Partners in Health on their YouTube, maybe? You can send a message in the chat again if you want. Why don't we just like go on a little scavenger hunt to find it really quickly? Because, or unless someone has the link for it. Yeah, okay. So yeah, Partners in Health has a YouTube account, by the way. So you just go to YouTube, blah, blah. Oh, I think it's on the crash course. Oh, it might be. You know what? It might be. So that's another reason to do the crash course, because like a lot of stuff, like even more than we could ever like put in one meeting, they will have in the crash course. While I'm doing this, if you want to like continue the discussion, Aya, like please feel free. Get in the way.
does anyone else have anything to say?
Okay. Well, I will also like add something. So like I think that yeah, like as I was getting the questions from you guys and like putting them in, like I learned so much as well. I think it just like shows like how important discussions with each other are, because like I like learned from you guys like through doing that, and like the amount of information that we can like share with each other, it's like never ending. So I think that was really cool. And yeah, I was like so shocked when I read that fact about the slave trade continuing until like 1928, because like it's so recent, it blows my mind. I don't know. um but yeah, so anyone else have anything they would like to
No, this was really helpful today.
Cool. Okay. I'm gonna send another link in the chat, and this is to John Green and his brother's YouTube channel. I'll share my screen with you guys to show you like what it looks like. But so John Green and his family have like partnered with Partners in Health, and they've like committed to like donating quite a bit of money to this project. And they do a lot of really cool videos about all of this. So oh, I don't want to watch it right now. But if you ever want to like learn more information, I think they do briefly mention maybe like in the Why Poor Countries Are Poor, they might talk about the diamonds. Because like I said, I don't really know where that specific video is right now. I can track it down for you guys later. But like there's just so many amazing things on this YouTube channel. And then also Partners in Health has YouTube account too. So there's that. Okay, I guess the discussion is like wrapping up. Thank you for doing that, Aya. Okay, let's see. I don't think I had anything else on the agenda. Do any of my leads have anything they want to add in? Okay. Do any of them, like the members, have any questions? Anything you guys want to talk about? Any, I don't know, questions, comments, concerns? Do you want
Not
to?
at the moment.
Yeah. Okay. Well, so I could play a video like from that Blog Brothers like account if you guys wanted to like watch one. Or I could go to the Partners in Health account and we could watch that. We could start the crash course together just to like give you guys an idea of what it's like. We could do Rosebud Thorn, which everyone knows I'm obsessed with. we could probably do a video and so I will try and find that one, like the one video that we played like a million times, or we could watch a new one. I don't know. I love all these. Let's see. Let's watch this one. This is a year update. So
On my first LSAT, I scored a
not this.
148.
Also, you guys,
I ended up with a
hate the LSAT.
174 and a
I have
Harvard Law
taken it
degree.
so
My
many
experience
times.
So almost exactly one.
Okay. Anyway, so I will play this video for you. Essentially, it's them giving a one-year update from like the project in like Sierra Leone and everything, and you can see it was in November. So it's pretty, I mean, it's more recent than like the older videos. But yeah, hopefully it's like informative and like interesting. And if you guys have anything you want to add, like comment in the chat or speak over the video, I don't care. But yeah.
1 year ago, we announced a new project to support Partners in Health and the government of Sierra Leone in their efforts to radically reduce maternal mortality. This initiative, which seeks to raise $25 million over 5 years, will strengthen the healthcare system in Sierra Leone's Kono district at every level, from hiring and training community health workers to building, staffing, and supplying a new maternal center of excellence at Koidu Government Hospital, which will have all the clinical spaces and services that mothers and their children need to stay healthy. That's everything from a child health clinic to a neonatal intensive care unit, to family planning clinics, to labor and delivery, to operating rooms. This maternal center of excellence will dramatically change the quality of healthcare available to women and children in Kono, and we hope it can provide a blueprint to reducing maternal and child mortality elsewhere in the world. Or at least that's what I said a year ago. It has been a very long year, and today I would like to give you an update on where we are. First, though, I want to recommend the documentary Bending the Arc, which is currently available on Netflix and which explores how, when the global health community believed that treating multi-drug resistant tuberculosis in impoverished countries was impossible, Partners in Health helped prove otherwise. Because I think it's helpful background in understanding why Partners in Health is now working to show that maternal and child mortality can be radically reduced, starting in a place with one of the world's highest rates of these unnecessary deaths. 1 out of every 20 women in Sierra Leone can expect to die in pregnancy or childbirth, and almost all of those deaths would be preventable with a strong healthcare system. Every day, women die for want of a safe emergency C-section, or for want of a blood transfusion, or for want of blood pressure medication, basic services and medicines that most of us living in rich countries take for granted. And we know this is not like inevitable or natural, in part because as the Sierra Leonean healthcare system has begun to strengthen over the last few years, there have been big reductions in child and maternal mortality. Like at the hugely successful Wellbody clinic that PIH runs, there hasn't been a single maternal death in years. The change is happening, we just believe it needs to be accelerated by a high-quality teaching hospital that makes pregnancy and childbirth safer for both mother and child. So where are we? Well, the original plan was to break ground on the Maternal Center of Excellence in April of 2021, but with COVID and everything, the plan is still to break ground in April of 2021, which is a wonderful credit to both Partners in Health and the government of Sierra Leone. And some system strengthening is already happening. More community outreach, more training for nurses and midwives, social support programs for pregnant women and new moms, and other maternal health initiatives. But recently, when I spoke to Isa Tadambaya, the nurse who leads Koidu Government Hospital's maternal and child health teams, she said the next big step for the community is the Maternal Center of Excellence.
A special care baby unit, we have a new unit, a new space that we've just moved the babies to. The results already in 3 months are phenomenal. But yesterday I went in there and it was full, which is why the Maternal Center of Excellence cannot come soon enough. This is a space and place where women in Sierra Leone would know for the first time that they are worthy of having the same level of care, the same treatment, the same access to equipment as anybody else.
Good grammar and spelling are important, but if you want to write essays that inspire,
Else in any part of the world.
The design for the Maternal Center of Excellence, created in partnership and consultation with the staff at the hospital and the community it serves, is really wonderful. It features lots of locally sourced materials, like the community is especially enthusiastic about the use of stones cast off from the nearby diamond mine to help build the hospital. That mine has become a symbol of destruction and despair for many in Kono, but now stones from that mine can become a symbol of hope. And of course, it'll have all the stuff a hospital needs: 24-hour electricity, capacity, safe and sanitary operating rooms, an extensive blood bank, incubators for the NICU, and so on, all resources the Koidu Government Hospital never had, even just a few years ago. It's hard to overstate how big the change will be. Like, the MCOE will almost triple the number of maternal hospital beds in the region. They expect to see over 4,000 deliveries a year, a 5-fold increase in the number of family planning visits, and critically, the MCOE will dramatically increase the number of medically necessary C-sections that can be performed. And because it's a teaching hospital, the MCOE will help train the next generation of Sierra Leonean healthcare workers, from doctors to nurses to community health workers. Right, so the overall 5-year cost of this project is $25 million, but in order to break ground, we need to raise $20 million. This is because both PIH and the government of Sierra Leone want to prevent a building getting like halfway built and then abandoned, or fully built but never adequately staffed or supplied, which is a huge problem in impoverished countries. Too often, people or institutions make big promises that they fail to keep, or make short-term investments that are quickly abandoned, and none of that strengthens the system in the long run, and so that's why we have to raise $20 million before breaking ground. Because thousands of you have become monthly donors to this project at pih.org/HankandJohn, and because incredibly generous matching donors from within Nerdviteria have banded together to match every monthly donation, at the current rates of donation, over 5 years we will have raised over $15 million. Another $3.5 million has come from large donors to PIH. Thank you. If you want a fuller, more detailed breakdown of the fundraising so far, there is a link to a video in the doobly-doo and the comments below. But yeah, altogether, we have raised over $18.5 million. In the last 13 years, Nerdfighteria has accomplished some amazing things, but that has to be the most amazing. And I know how grateful all of our PIH friends in Sierra Leone are to you all, but there is still a funding gap. Like, one way of looking at this is that we have raised 93% of the money we need to break ground, and another way of looking at it is that we still have $1.5 million left to raise, which is a lot of money. I expected that because of the pandemic and the tremendous stresses it has caused, that donations might go down, but in fact, they have gone up every month, and I find that so encouraging. And of course, we understand that many of you are not in a position to donate right now, and that is okay, but if you are able to become a monthly donor at pih.org/HankandJohn, it can make a huge difference. I have seen how critical the need is for better child and maternal health care in Kono. It is an emergency. It's just one that doesn't make headlines. Also, in order to get to the $20 million mark, we are going to need some larger donations. So if you happen to be in a position to donate, say, $5,000 or more to this project, there is a separate link in the doobly-doo below, or you can email me at sparksflyup@gmail.com to learn more. I want to emphasize one thing, though. The MCOE will be, like all of Koidu Government Hospital, owned by the people of Sierra Leone through their government, and it will be staffed almost entirely by Sierra Leonean healthcare workers and supported and funded to a large degree by the government of Sierra Leone. The heroes of this story are the people like Aissata, who sacrifice so much to help vulnerable women deliver safely. Hank, I said earlier that 1 in 20 women in Sierra Leone can expect to die in pregnancy or childbirth. Not long ago, that statistic was 1 in 17 women, and so maternal death is declining, and the progress is real. It's just not fast enough. Every healthcare worker I've spoken to in Sierra Leone has gut-wrenching stories about the pain of knowing what needs to be done to save the life of a mother or a child, but being unable to do so because there is no working ambulance, or there is no blood bank, or there is no safe operating room. As one PIHer told me, we know how to save women's lives, we just need the tools. And that is our challenge and our opportunity to help provide the tools to this community so that they can radically reduce maternal and child mortality. So again, if you can join us in donating, the link is pih.org/HankandJohn. To the thousands of you who are already monthly donors, thank you. We are 93% of the way there. And if you can't donate, thank you for your attention. It matters. If the world was paying attention to this crisis, more would be done to stop it. So thank you. And Hank, I will see you on Friday.
Okay, any comments, reflections on that video, questions? Also, my computer is dying, so if I leave. Whoa, Kara. Whoa, Kara. It's Sunday. Okay, anyway, yeah. Does anyone have anything they want to add?
It's kind of cool to see their little predictions for what it's going to look like.
Mm-hmm.
I don't know what that's called. The rendering. Yeah.
a
That's cool.
rendering. Yeah, it was really cool. Okay, actually, I'm gonna run and get my charger. Does anyone else have any other reflections from the video? Oh, okay. Well, okay, so we have 5 minutes. We can do Rosebud Thorn. Maybe we could just do like a bud. Okay, so Rosebud Thorn is this like little activity I love to do. I'm sure some of you have heard of it before, where like you just reflect on your day. So your rose is the highlight of your day, the best thing that happened. Your bud is something you're looking forward to in the next few days. And your thorn is like the low point or like something you wish had gone better. So I think we'll do bud, so something you're looking forward to in the next few days. And so I'll go and then I'll like popcorn someone and I'll like invite someone else to share. So I will say my bud. I'm looking forward to my friend is having a murder mystery thing for like a few of us on Wednesday. I'm very excited about that because I think murder mysteries are like super fun. We'll have to figure out how to like incorporate a mask into the costume, but it's fine. It'll be fun. And I will popcorn to Ellie.
Well, you only did your bud.
I know. We only have 5 minutes.
Okay, fine.
A bud is that I'm in a sorority, and so we're like starting to find littles, so we're going on like a bunch of like dates with them. So I'm excited to meet all the new members.
Okay, cool. And you can popcorn.
Oh, should I popcorn someone? I popcorn Julia. I know you said you can't talk, but I can popcorn somebody else if you don't want to talk.
I can talk. So my bud is that I have a bit more of a laid back week because I just finished all my midterms last week. So I'm excited to not stress about that anymore. And I'll popcorn Alexis.
My bud for the week is that on Wednesday night, me and my friends are doing Italian night, and we're all just making up, like there's 15 of us, and we're all just making different Italian dishes. So we're gonna pig out and eat a bunch of good Italian food. So I'm definitely very excited for that. I'll popcorn to Emma.
My bud is probably the finale of WandaVision this Friday. And then I'll popcorn to Jack.
Hi, my bud, I think, is going to be going to the Columbus Zoo with some friends who aren't from around here and haven't been ever, so I think that'll be a lot of fun. And I will popcorn to Logan.
So I am just really looking forward to spring, and I've been really enjoying the nice weather that we've been having. And then I will popcorn to Ava.
You mean me?
Yeah, I'm so sorry.
You're good. Yeah, it's Aya. But my bud is, so I recently dropped a class because I just didn't like it, and I have room next year to take it again. So I just have like a little extra time on Monday, Wednesday, and Fridays, which would just be nice to, I don't know, probably nap. But and I'll popcorn to Cisse.
I'm not really looking forward to it, but tomorrow I'll start my 10 days study for the state's exam. Yeah. Would that be your turn? Yeah, and let me see who to pass it. Who hasn't gone yet?
I haven't gone. I'll go.
Okay.
My bud is that I think my mom is going to come visit me next weekend, so I'm really looking forward to that.
Awesome. Okay, has everyone gotten a chance to go? Cool. Okay. Well, thanks for doing that with me, guys. I'm glad we got to do a little bit of my rosebud thorn. But yeah, so that's it for tonight. If you guys have any questions, comments, or concerns, please let any of us know. We'd be happy to help. Yeah, definitely glad to see you guys all come to the meeting tonight. So we'll see you next week. Oh, before you go really quickly. So I mentioned before, like we're gonna be starting to like log volunteer hours. I was just like, I realized I never really like asked your guys' like opinion on that. So like, does anyone have any like thoughts on like, is that something that like you think like you would want to work towards? Or like, do you think maybe, I don't know, like basically I would just love to like gauge where you guys are on that.
On what topic? I'm sorry.
So like we have decided to like work towards a goal of 100 volunteer hours as a team, and that can be in whatever fashion you choose. So like one of the examples is like with the St. Stephen's Community Center. It's like a food bank essentially, and like I've been volunteering there, but we know like other people may have other volunteer things that they already do. So that's
Yeah.
yeah.
I'm volunteering at the vaccine station right now. At the shots at OSU.
Okay, cool. So yeah, if you want to like log your hours and like let us know, we could like add that to the goal. Um, like like basically is volunteering something you guys like think you would have time for, like you would be interested in doing, like despite COVID, if it's like in a safe environment, like I don't know. I just like I don't want to have a goal set if it's not something that like we think we're going to be working towards, if that makes sense.
Yes, okay.
So yeah, I guess just like think about it. If you guys have anything you want to like add to that, just let me know.
Also, if you guys ever have any ideas that like stuff that you want to do during the meetings and stuff, like we'd love to hear your input and like any other ideas you have, because like obviously that would make it more fun if we all get involved with it. So if there's anything that you like done with another club or you think would be cool, like just let us know, because we would like love to do any of the activities that you guys suggest.
Awesome. Yes. Okay. Now I think we're done. So thanks for coming, you guys, and we'll see you next week. Adios. До свидания. Cool.
I have a quick question.
Yeah.
So is there like a spreadsheet where we can enter the hours, or do we just tell you? Because I have quite a few hours that I can contribute, because I work consistently with like the Red Cross virtually. So I have a lot of hours from the past couple months. I'm not sure how far back you wanna
So
go.
probably just starting in like January.
Okay, I can look that up and I can let you know.
Cool. Yeah, that'd be awesome. Yeah, you can just message me directly and I'll like log it. I like keep the tracker in the newsletter. So I'll just like add it into that. Cool. And then also, since you're here, I know you had a chance to speak with Alexis. I don't know if you have met Aya yet, but this is Logan. And he and I had a conversation a few weeks ago about possibly like advocacy slash like maybe being more involved. So I just kind of like wanted to like bring that up again and see like if you have any thoughts on like any of the information I sent you, or like if you were able to do the crash course, if you're still interested in like being involved in the advocacy team. Yeah.
Yeah, I'm definitely still interested. I know I got kind of busy the past few weeks, so I haven't gotten to the course yet, but I have it on my to-do list.
Is this my computer freezing? Oh no.
Very low pressure environment. We all mess up all the time, and it's not a big deal. Like you don't have to like practice or anything. It's very like fun and like.
Yeah, sorry, my internet is really bad right now. I missed almost all of that. So, okay, but yeah, was there anything pressing while I froze? No.
I don't think I have any concerns right now. I was looking at the something you sent out in the newsletter, and I don't know what it was. Let me look what it was.
Okay.
Oh, it's just the campaign summary. Yeah. So I was looking at all of that, and that has a lot of information that's relevant.
Cool. Okay, awesome. So yeah, in the next 2 weeks, we're definitely gonna be like picking up in terms of like getting the applications like out there. It's not a long application, but like if you're interested still, we can like work together to like work on that. I know there's another individual, she's interested as well, so it could be like a possible like co-lead situation. If that's something like you're interested in. I know Katie and Aya are co-leads and they are great at it. So yeah, but basically I just wanted to
Sounds really
bring it
good,
up again.
actually.
So. Cool. Okay.
Yeah, the
Yeah,
co-lead
so
sounds really great.
okay, cool. Yeah, it is. It's all great. So yeah, if you have any questions, message any of us and we're more than happy to help. And yeah, just kind of keep your eye on it and let me know if you have any questions about the crash course or anything like that. So cool.
All right, well, thank you.
Yeah, thanks for coming. It was nice to see you. See you next week.
Yeah, of course. Yeah,
Okay.
bye-bye.
Cool. Bye. Okay, awesome. So we did it. That went well, actually. I was really happy with the number of people. Yeah, that was good.
Pretty good.
Cool.
Yeah,
Okay.
that was really good.
And Ellie was new, and Jack was new. So we had 2 new people. So that's exciting.
Yay.
Yeah,
Yeah,
that was cool.
Yeah, we had like what, 12 people this week? That's pretty good.
Mhm.
Yeah.
Yeah, definitely.
Oh, let me stop recording. Ew.